would be easier really to control, even the spacing, at least enforce to the barest minimum. Sa barangay, there is the purok and sitio. You can always schedule it for the purok. So, ilan lang yung maglinya. Then, after that, the sitio will be the next venue. And the third is so forth and so on. Let's start with the basics, basic political unit. Ganon sana ang walang lang isip yung mga what they just do is just to show to the people that they care, but they do not really care because of their ignorance.
The News Day continues here on One News Now. I'm Charles Lejano. House lawmakers advocating for the use of Ivermectin to treat COVID-19 have launched their own community pantry to distribute the drug. This despite the Health Department's stern warning that only hospitals with permits are allowed to do so. To give us more details on this initiative, we have Marian Enriquez. She's reporting to us live from Quezon City. So, Marian, health officials are clear about their stand on this matter. So, how come these individuals are proceeding, and who are the lawmakers behind this initiative?
Yes, Charles, around 200 individuals have received free human-grade Ivermectin capsules here in Barangay Old Balara, Quezon City. Those who are promoting the use of Ivermectin to fight and treat COVID-19 are Anak Kalasugan Representative Mike Defensor and Sagip Party List Representative and Deputy Speaker Rodante Marcoleta. They are both present here in the event. They are joined with some physicians from the concerned doctors and citizens of the CDC or the CDC-PH, and they are the ones conducting a consultation and giving prescription to the residents. Charles, you know, the FDA has clarified that they have no objection with the distribution of free Ivermectin here in the QC and with their initiative. Now, they said that as long as there are doctors or physicians checking the condition of the residents before they give the prescription, it's okay. And also, they've also clarified that the group here doesn't need to acquire a certificate of special permit or certificate of special permit, or the CSP that were given to hospitals, because as long as they have partnered compounding or licensed compounding laboratories that will produce the drugs, it is okay with them. Charles?
Right, Marian, let's break this down. I understand there are doctors present there and there are certain safeguards in place. Could you kindly explain to us what the doctors there are saying? How are the people there reacting? Are people really into this?
The priority of residents that were given this Ivermectin drug were senior citizens. So those who are lining up here, we were able to talk to them, and the doctors checking their condition. So the first thing that they usually ask is how to take this drug. So if you're just taking this for prophylaxis or for prevention, the doctors are advising to take this one tablet or one capsule a day for 2 days, and then after that, after 2 weeks. And they're also saying or advising them of the possible side effects, which are diarrhea, nausea, and I think also allergy. So at first they also are checking about the heart condition and if they have liver problems. So those are the things that they are actually really monitoring, Charles.
Right, so Marian, you mentioned earlier that the FDA says they are allowing this to proceed, but then have we heard from other authorities about this initiative? If so, what did they have to say? There appears to be some sort of violation here, yes?
Yes, Charles. Actually, USEC Health Undersecretary Maria Rosario Vergere, during her public briefing yesterday, announced that only those hospitals with the CSP are allowed to distribute COVID-19 Ivermectin drugs. Now, FDA Food and Drug Administrator Director General Eric Domingo said yesterday in an interview with him, he said he clarified that this distribution is above board, so it is okay, it is legal, and as long as there are physicians, as long as there are doctors, and a licensed compounding laboratory will produce the capsules or the ivermectin drug, they are allowing this. Charles?
All right, so Marian, if, for example, health authorities block the unauthorized distribution of ivermectin, what would then be the plan of lawmakers and other organizers behind this initiative?
Charles, according to Congressman Mike Defensor yesterday during his press con, he said that he will fight them in court to whoever will stop their distribution of ivermectin drug. Now, I don't think that there will be a problem with that as long as, the FDA is supporting his statements or the group's initiative. Charles?
All right, thank you for those updates. That was Marian Enriquez reporting live from Quezon City. The Philippine Embassy in India says they're now in talks with our government to ensure that overseas Filipinos in the South Asian country are taken care of. In an interview with Radio 5, Philippine Ambassador to India, Ramon Bagatsing Jr., said they've talked with the DFA to discuss funding and medical requirements for Filipinos living in India. Bagatsing said that about 3,000 Filipinos are living in the South Asian country, with most of them Filipinas married to Indian nationals. However, the ambassador said that some of our countrymen badly want to go home.
Hindi ba humingi naman ng repatriation sa TED? Ang problema natin kasi there is a de facto travel ban right now sa Pilipinas. Sa Pilipinas, actual tayo. Pero sa totohanan lang, kasi lahat ng lugar na dadaanan ng isang pasahero galing sa India ay bawal. So we cannot, at this stage, repatriate itong ating mga kababayan. We have to wait until all these travel bans are lifted.
Filipino community leader in India, Victoria Singh, also said that our kababayans there are doing okay, despite the surge in COVID-19 cases. And they managed to stay in touch, even with those who have tested positive and are recovering from the virus. But Singh admits that the one thing that's stopping them from extending more help to others is fear of the virus itself.
Takot na po dahil po nag-iisa lang po ako dito sa bahay, lahat po kaya hindi po ako lumalabas. Marami po talaga natatakot kasi po kahit na po nasa bahay nakakasakit din nakakaroon din ng COVID Tapos we cannot help each other because we cannot go out, even that one Filipino passed away because of that.
Still on ivermectin, the health department plans to start clinical trials for the drug by late May or early June. This as some lawmakers continue to advocate the use of the drug as a COVID-19 treatment. To give us more details on this, we have Greg Gregorio now joining us live from Mandaluyong. Greg, good afternoon. How long will these clinical trials run?
Yes, Charles, it's actually the Department of Science and Technology who will initiate the conduct of these clinical trials for the use of ivermectin in the Philippines. And according to DOST-PCHRD Executive Director Dr. Jaime Montoya, they are targeting to do this clinical trial for 6 months, and they are expecting a result of this clinical trials by the end or within the year. Charles?
All right, Greg, let's go into more detail on this clinical trial. How many participants are going to be included? And will critical patients be included in the trials?
Just according to Dr. Montoya, they are still finalizing the trial protocols that will be used for these clinical trials. But at this early, what he can disclose is that they are targeting to recruit participants for this clinical trial aging 18 and above, and for those asymptomatic to mild COVID-19 patients who are in quarantine facilities and in NCR. Charles?
Right, Greg, I was speaking to Marian just a couple of minutes ago, and she was at this gathering where they were giving ivermectin away for free. What does this mean? Is ivermectin now allowed to be used to treat COVID-19 patients, or is there still an actual limitation on this in effect?
Charles, up to this date, the use of ivermectin, if you will ask the Department of Health, it is still limited for those individuals or organizations given a compassionate special permit for the use of ivermectin. And as of date, there are only 5 hospitals who were given by the Food and Drug Administration this CSP. And a statement, and according to a statement by Dr. Marisa Alejandria, a member of the Living CPG, a group of who gives guidelines on the use of investigational drugs against COVID-19, including ivermectin. She said that the use of ivermectin is still dependent to the entities or the individuals who will apply for authorization, because until now they can say that there is an insufficient evidence for the use of ivermectin to any of COVID-19 patients, and this is the reason why a clinical trial is still needed to be conducted here in the country. Charles?
Right, let's talk about other treatments that they're considering for COVID. There is this Pfizer treatment allegedly being prepared, an at-home pill that could be used to treat COVID-19. What was the reaction of authorities about this?
Yes, Charles, we've asked Dr. Marisa Alejandria and Dr. Jaime Montoya about this, but according to them, there is still a limited information about this Pfizer COVID-19 pill, and thus they would have to wait for more information about the progress of this pill. But according to Dr. Alejandria, it is a welcome progress for a pharmaceutical company or organization to look for compounds in order for us to fight this pandemic. But again, they would have to wait for more information from this COVID pill that is under experimentation. Charles?
Yeah, Greg, while we're at it, let's talk about virgin coconut oil as another possible cure for COVID-19. Do we have any updates on this?
According to Dr. Jaime Montoya, even though we had an initial study on the use of virgin coconut oil on suspect cases late last year about the use of this virgin coconut oil, there is still an ongoing clinical trials in Manila, and they are going to start another clinical trial for the use of VCO in COVID-19 patients in quarantine facilities as well as in hospitals. But according to Dr. Montoya, even though these clinical trials are still ongoing, anyone may take VCO, but anyone may take VCO because it has been approved by FDA even prior to this pandemic, but only on the fact that it is a food supplement. So up to now, we cannot say that it is effective for use against COVID-19, and that is the reason why we are having clinical trials for such. Charles?
All right, thanks for all that, Greg. That was Greg Gregorio reporting live from Mandaluyong. And those are the top stories of the hour. Join us again later at 1 p.m. as we continue to monitor the day's biggest stories. You can also catch One News on Signal Play. Register for a free account at www.signalplay.com and stream One News live anytime and anywhere. I'm Charles Lejano. Mask on, wash hands, and stay safe, Philippines. We are One News.